Oklahoma continues to rank near the bottom of states for its nursing home care and the health of its older citizens. The latest surveys by two organizations show too many of Oklahoma's senior citizens are inactive and overweight, while many of those living in nursing homes receive poor care, largely due to inadequate staffing. And often, poverty leaves many Oklahoma seniors without adequate access to health care.
I'll see you again in 3 months' time.
Thank you so much.
Mary Tomlin is a very active 70-year-old. She's a member of a women's club and is a veteran quilter. She says it's a joy being a senior, and as a young person, she actually looked forward to growing older.
Because I look around and I would see people that at that time was twice my age that was really just moving right along. They had so much to share, so much to know, and so much to do.
Nearly 548,000 Oklahomans are over 65 years of age, and their numbers are growing daily, while new studies show the overall health of Oklahoma seniors is not like Mary's. Oklahoma ranks 47th in the United Health Foundation's 2014 Senior Health Report. Dr. Dwayne Andrews is Senior Vice President and Provost at the University of Oklahoma Health Sciences Center.
More than 30% say they are only in fair or poor health. More than half of the seniors have some form of arthritis. A fourth of them have diabetes.
The Foundation's report concludes that access to health care for seniors is based in part on their personal finances. A second report from the Families for Better Care organization gives the state a failing grade and ranked it 49th in the nation overall for the care seniors receive in nursing homes. The poor scores come as the healthcare system and nursing homes are facing major increases in patients and clients as baby boomers age into the senior citizen category.
A crisis that's coming up on the state and federal government that no one's talking about. 10,000 people turn 65 years old every day in the United States.
State Representative James Lockhart has personal experience with the care Oklahoma senior citizens are receiving.
My grandma was in the nursing home, and there were times that I went in her room and it smelled so bad in there. And I'd go get the staff and they'd clean her up and clean the room up, but it was just awful having to see my grandma like that.
Representative Lockhart says bed space is at 70% capacity in Oklahoma nursing homes, so helping people stay home and still get the care they need is increasingly important.
The need for home health, there's no way around it that I see. More and more people will need those home health services. That's just going to be part of this deal going forward.
Educating people who find themselves providing in-home health care is a goal of the Oklahoma Healthy Aging Initiative. The Aging Initiative received a 3-year, $11.5 million grant from the Donald W. Reynolds Foundation to expand its effort to improve the health of Oklahoma seniors. While the Aging Initiative predicts yearly progress in improving the state's elder health ranking, it will take more than just private donations. Dr. Lawrence Rubenstein is chairman of the Department of Geriatric Medicine at the OU Health Sciences Center.
It'll take leveraging our program with the state as well. The state has to start investing a little bit more of its resources in health care and human services than it has been traditionally. And I think that's also key.
Dr. Andrews agrees, saying public officials need to act now or they will find themselves forced into reacting to what is coming.
The demographic impact of an aging population is going to force our politicians to sit up and pay attention. Most of them right now are really not in the senior group. There's not much institutional memory either in the legislature.
The Reynolds Foundation grant will create 2 new telemedicine centers enabling geriatricians to reach every corner of the state to assist local physicians providing health care for the elderly.
OSU Center for Health Sciences, they do the State of the State report every year, and basically in southeast Oklahoma, they say that Oklahomans are living shorter lives and having less access to health care.
Speaking at the news conference announcing the Reynolds Foundation grant, Mary Tomlin told those present that public officials need to remember seniors are the people who almost always make their way to the voting booth.